Millions of Americans have arthritis, and a large majority of them happen to be women. So Dr. Frida Lewis-Hall, the Chief Medical Officer of Pfizer, is back with some helpful information if you or maybe a loved one is suffering. Welcome back.
Oh, thank you, Dr. Travis. Great to be back. You know, all arthritis is not created equally. In fact, there are over 100 different types of arthritis. Now, the most common two types of arthritis are osteoarthritis and rheumatoid arthritis. And they have some similarities, but they're not the same. They have different symptoms, and they have different treatments. Now, osteoarthritis is the most common by a long shot, and it's the one that we commonly refer to as wear and tear arthritis. The symptoms begin to start at about middle age, and then by the time we're 70, most of us have some symptoms of osteoarthritis. If you take a look at this hand, cartilage is provided in our joints as a natural cushion for where bone meets bone. Over time, it begins to wear away or thin, and we end up beginning those symptoms of osteoarthritis like stiffness in our joints and pain. And sometimes the cartilage wears all the way away, and we end up rubbing bone on bone, and that, as you can well imagine, is extremely painful.
Now, let's move on to rheumatoid arthritis, which is an autoimmune disorder. It's not limited just to joints, because it's truly an autoimmune disorder that may involve other organ systems. People with rheumatoid arthritis, they may not only feel ill overall, maybe constantly fatigued, it can also affect anyone at any age. Should we go take a look at why this may happen? When I say autoimmune disorder, I essentially mean that your body's immune system attacks healthy tissue. In the case of rheumatoid arthritis, we're talking about joints. What you're looking at here is a synovial membrane. That encapsulates the joint and does something very important. It secretes a fluid that keeps that joint nice and mobile. But in the case of an immune cell, normally these things are supposed to attack foreign invaders, but they mistakenly, in the case of rheumatoid arthritis, attack that synovial membrane. It attacks healthy tissue. It can destroy those joint spaces. It can cause a lot of pain. One clue that it might be rheumatoid arthritis is that it affects oftentimes both sides of the body, symmetrical type of arthritis. So maybe it's both knees are really painful, both hands are really painful. With osteoarthritis, the wear and tear, it literally could be confined to one side, maybe one joint in particular. So this is an example of the wear and tear. Maybe your right knee, tons of osteoarthritis, a lot of pain, and that may be the only joint affected.
And because it's a deteriorating disease, it can come on slowly over time. And that's unlike rheumatoid arthritis, which can come on rapidly or can come on in flares off and on over a period of time. And rheumatoid arthritis can really cause significant damage to joints and even deformity. This is a normal, healthy hand. This is the X-ray of someone who has rheumatoid arthritis. And as you can see, these joints are significantly enlarged and really crooked, and this happens over time.
We actually had a viewer share a brief glimpse into her own journey with rheumatoid arthritis. Let's have a look.
I always had trouble with my hands, but I really started to notice it in college. It became harder to type my papers, and I lacked energy. My feet and my hips also began to hurt. I also had to cut my long hair because it hurt too much to brush it. I could barely brush my teeth. Most of the joints on my body were either red, swollen, or tender. My doctor referred me to a rheumatologist and diagnosed me with rheumatoid arthritis.
And just like Elizabeth, if you have any of the symptoms that she described, go and see your doctor. Because remember, different types of arthritis have different types of treatment. And if you do have the type of arthritis, the osteoarthritis, wear and tear, there are things that you can do. Some people have taken to swimming and water aerobics because it's really important to keep those joints mobile and flexible without putting too much stress on them.
And I love the fact that you raise up the point that when you have arthritis, it doesn't mean you should stop using your joints altogether, because it means that they may get worse. Little things that you can do to relieve some of the pain, make exercise a little bit easier. You can try things like heating pads, maybe even warm baths. That can help ease the muscle tension around the joint and go ahead and increase circulation in that area. More blood supply. It will literally warm things up, get it easier to move. But if you're having pain, say after some exercise, you can use cold compresses. That reduces blood flow. It can actually numb the sore area, make it feel a little less painful, and reduce overall inflammation as well as swelling.
And if you want more information on different types of arthritis, go to gethealthystayhealthy.com.
And if you feel like you may be affected by arthritis, you want to talk to your doc about the treatment options, figure out what may be going on for you, put together a treatment plan, and as always, you can visit thedoctorstv.com for additional information. Thank you so much, Dr.
Thank
Lewis
you.
Hall. Always a pleasure.
good.
Coming up, one last thing you should know before you buy any product that promises to solve all of your health dilemmas. Stick around. Closed captioning provided by